As is our tradition, we ask a representative of the school's Alumni Association to bring official greetings to you and to welcome our graduates to our alumni community. It is therefore my honor to introduce my friend, Rashad Massoud, President of the Harvard Chan School's Alumni Association. Rashad received his MPH in International Health from the school in 1993. He is a physician and a public health specialist who is internationally recognized for his leadership in global health care improvement. Rashad currently serves as director for the USAID Applying Science to Strengthen and Improve Systems project. He is also Chief Medical and Quality Officer, as well as Senior Vice President of the Quality and Performance Institute at University Research Company. URC is an international organization that provides innovative, evidence-based solutions to health and social challenges worldwide. At URC, Rashad leads quality improvement efforts in more than 40 countries, applying improvement science to deliver better results in global health priority areas. It is my pleasure to invite Dr. Rashad Massoud to the podium to deliver the alumni greeting.
Thank you, Dean Williams. Graduates of the class of 2019, proud parents and families, honored guests, esteemed faculty and staff, Honorable Dean Williams, and distinguished commencement speaker, Cecile Richards. As president of the Alumni Association, I'm honored to be here today and to formally welcome the 2019 graduates of the Harvard T.H. Chan School of Public Health as new members of our Alumni Association. Fellow alumni, I congratulate you on your achievement and salute you for your commitment to public health. What you have learned at the Harvard Chan School has equipped you with the knowledge and skills you will need to navigate the ever-evolving landscape of public health. The school has prepared you to continually learn and tackle the challenges that will come your way as you work to improve lives. The world needs you, needs all of your innovative thinking, your methods, your skills, and your leadership. Years ago, I stood in your place feeling armed with the best knowledge and skills, ready to embark on a new and fascinating adventure. I had the confidence and the conviction to take on any challenge, and there were many. One of them was when I worked as a physician in a primary care setting. In this role, I received about 100 patients a day. The waiting times were long and frustration was high. Every physician in that system faced a similar workload. Equipped with the methods of data analysis, process redesign, and teamwork I had learned at the Harvard Chan School, I got to work solving the problem. I set up an improvement team. We started talking to patients and analyzing the reasons for their visits. The data showed us that some patients didn't really need to see a doctor. Many patients came for a lab referral or for a repeat prescription for an otherwise stable condition, and so on. We started to categorize the reasons for the patient visits and to redesign the clinic process. We managed the categories one at a time, testing changes, monitoring the results, and instituting the changes that worked. Over time, we reduced the number of patient visits to a physician from about 100 to about 15 a day. Patients and staff were happy. Patients went out of their way to thank us for these changes. As you can imagine, I was very proud of this accomplishment. I wrote up the results. I provided the data to support the redesign. I sent the documentation to the system leadership and recommended scaling this up to all the health centers in the system. I eagerly awaited the response. When it came, it wasn't quite what I was hoping for. In fact, it was just the opposite. The leadership of the system instructed me to immediately return everything back to what it was before and told me that I should operate in accordance with the policies and procedures of the system. It was a huge, unexpected disappointment. Now, in parallel with this, and in a voluntary capacity, I also chaired the Harvard University Middle East and North Africa 5-country program to introduce improvement methods to the region. This work attracted attention in the medical community beyond the health system I was working in. Shortly after the incident, I received and accepted an offer from the Emerging Health Authority in Palestine to lead improvement in the country. I started to work at a scale way beyond one health center or even one health system. Several years and many improvements later, I joined the company and the project I'm with today, working on improving healthcare globally. To date, I've contributed to improving healthcare in 102 countries. So why am I telling you this story? My message is simple: never give up. I know the excitement and passion with which you are graduating. I know that each and every one of you will make a huge difference. But it may not be a walk in the park, and there may be obstacles, and you may encounter disappointments along the way. I certainly did. But do not let that take you off track or reduce your ambition. Never give up. Finally, as you graduate, you become an important member of our vibrant 14,000-strong global alumni network. You will find Harvard Chan School colleagues, peers, and mentors all over the world. This is a network of some of the world's most extraordinary public health scientists and practitioners. I invite you to join the Alumni Association's activities, committees, and council as well, so you can become even more deeply involved in our global public health efforts. Your worldwide Harvard Chan community is waiting for you. Once again, congratulations.